it has two dimensions. Ayushman Bharat, as an initiative of the Honorable Prime Minister, has two twin missions, and both carry the name of the Prime Minister. So we have the Prime Minister's National Health Protection Mission, which is more famous, and it concerns so much more to this audience. But there's also Prime Minister's Health and Wellness Mission, which is targeted to primary health care upgradation of our country. Primary health care is the strongest requirement of any nation's health system. Nations like UK, Europe, much of Europe, Sweden, Finland, Canada, they spend 80 to 90% of their resources on primary health care. You're all familiar with how it works in UK, I'm sure, that you have a general physician, team of nurse, physiotherapists in a GP office, and most of your needs are met without having to pay very much. If you look at our existing services at the primary health care level, through our sub-centers and primary health centers and corresponding structures in the urban area, we were only covering 15% of our needs. What were we covering? Reproductive health, maternal health, child health, ORS, immunization, malaria, to an extent TB. That's it. This is 15% of our need. What about eye care, ENT care, old age, mental health, hypertension, diabetes, cancer screening? We are not doing that. So that's the 85% which our population at large had no access to, close to their homes. Primary health care is about services that are close to home, they are comprehensive in nature, and then they are outpatient. Inpatient, you refer. So they are ambulatory services. That's the definition. So what we are doing is, through this visionary action, is to move and meet this unmet need once and for all for India. It's a system level change. It's not one additional thing that we are trying to do for, let's say, filariasis, okay, or tetanus, or one more vaccine being added. It's a huge, big thing, and we will deliver this by the year 2022, when India attains 75 years of its independence. The Prime Minister wants development to be a Jan Andolan, people's movement. And he tells us that health and nutrition must also be Jan Andolan, people's participation, and that's the way this is being thought through. Ayushman Bharat is not just an incremental change for India. It's not. It's a quantum jump. It's a transformation that we are starting. Likewise, the secondary and tertiary care now is existing to an extent. It's not optimum, it is not copious. There is a deficiency on the supply side, but we have private sector, we have public sector, and together, through the bridge of financial protection of NHPM, the other mission, we connect poor people to these services. So this is transformational, both at the level of primary care as well as a secondary and tertiary care, in a huge, big way. For the first time at that scale, we are talking about partnership of public and the private sector, once and for all. This will not be reversible.
India's healthcare industry is one of the fastest growing sectors, and in the next 10 years, it is likely to reach $275 billion. With growing consumer needs for high-end diagnostics, improved medical quality and precision, the capital investment in the sector has grown multifold. The sector in India is well diversified, full of opportunities. Medical tourism is growing at 20-25%. Standard Chartered Bank is proud to be partner in this growth with our specialized products to cater to your needs for effective collections and payments. We are focused on helping your business by providing bespoke solutions using our expertise developed over the years and across markets. We have a legacy of 160 years in India.